Hi, my name is Colin Lightbody, and I'm the president and founder of HR and Labor Guru, Inc. On behalf of the company, I'd like to welcome you to our on-demand webinar series. Before we get into the presentation materials, I'd like to take a few minutes to let you know a bit about our company and also give you some insight into my professional background. First, let's talk about the company. HR and Labor Guru's goals are to provide practical, value-added, human resource and labor solutions to our clients through on-demand webinars, plus training and consulting engagements. Our company specializes in a number of areas, including the following. First is bargaining preparation and strategy formulation for labor negotiations, development of negotiations costing models and bargaining tools, identification of opportunities to reduce and/or mitigate rising labor costs, healthcare cost reduction strategies, addressing high unplanned absenteeism, including FMLA in the United States, and finally, HR analytics in terms of building effective analytics teams and identifying and executing high-value projects. Next, let's talk about my professional background. I established HR and Labor Guru in 2019 after retiring from Fiat Chrysler Automobiles, or FCA, with 20 years of service. My last position held at Fiat Chrysler was Director of Labor Economics, People Analytics and Insights, and Hourly Attendance at Chrysler World Headquarters in Auburn Hills, Michigan. In terms of labor negotiations, I have over 20 years of union negotiations experience, and I've been actively involved in numerous multi-billion-dollar deals. While at Fiat Chrysler, I was actively involved in virtually every set of national negotiations in the United States with the United Auto Workers Union since 2003, every set in Canada with Unifor, formerly known as the Canadian Auto Workers Union, since 1999, and every set in Mexico with the CTM Union since 2004. My roles and responsibilities ranged from being a bargaining subcommittee chairperson to benefits accounting, labor economics, and labor strategy expert, to negotiating with presidents of the national labor unions. In 2007, I participated in the negotiation of the transfer of Chrysler's multi-billion-dollar retiree healthcare obligation to a United Auto Workers Union-sponsored healthcare trust. In addition, over the years, I was actively involved in facilitating several special agreements, including corporate restructuring deals pertaining to shift eliminations, plant divestitures, and plant closures. In my opinion, though, my biggest claim to fame is the fact that for many years, I provided strategic bargaining guidance and worked directly with the late FCA Chief Executive Officer, Sergio Marchionne, arguably one of the best negotiators of all time. Also, I was a member of the Mercer Labor Employee Relations Network in the United States for over 10 years. Therefore, I had the distinct pleasure of networking, benchmarking, and sharing best practices with some of the world's top labor executives from multiple industries on topics ranging from absenteeism challenges to labor negotiation strategies. In terms of HR analytics, as head of the People Analytics and Insights team at Fiat Chrysler, I directed numerous special studies, including the following: internal labor market maps and employee turnover studies for the salaried workforce, and deep dive studies on topics such as absenteeism and hourly hiring process for the hourly workforce. In addition, I was an active member of Mercer's HR Analytics Network, known as the Internal Labor Market Network, for over 3 years in the United States. As a member of this group, I had the opportunity of networking with some of the world's top HR analytics professionals and consultants. We regularly shared stories about growing pains, the challenges, the success stories, and the lessons learned from our unique HR analytics journeys. From an educational perspective, I'm a professional accountant, both a CPA and CA, and I was employed at Deloitte & Touche for 10 years prior to joining Fiat Chrysler. I also hold a Bachelor of Commerce degree with a concentration in accounting and finance from the University of Windsor in Windsor, Ontario, and also hold a Master of Business Administration degree with a concentration in human resources and labor relations from Wayne State University in Detroit, Michigan. I'd like to start off by talking about why you should attend this webinar. Rising all-in labor costs are one of the most significant challenges facing employers today. Labor cost increases are primarily attributable to wage and healthcare cost inflation. This webinar represents part 2 of a 2-part series that focuses on identifying strategic opportunities to reduce and/or mitigate rising all-in labor costs. Specifically, this module highlights cost mitigation strategies relative to healthcare, pensions, and other employee benefit costs. It provides numerous practical alternatives for organizations to consider in addressing these particular components of all-in labor costs. The content in this module has been designed to appeal to a broad audience, ranging from employee benefit specialists who are engaged in designing a new employee benefits package to labor relations professionals who are strategizing for upcoming union negotiations. Part 1 of the series focuses primarily on cost mitigation opportunities relative to modifications to compensation structures and workforce composition. The learning objectives for this module are as follows. 1. Gain an appreciation for the importance of plan design decisions. Things like employee cost share, delivery models, clinical programs, and driving overall employer healthcare costs. Secondly, identification of the multiple levers, strategies, and tools available to mitigate rising healthcare costs. Third, look at a 3-step analytical approach to identify key focus areas in order to facilitate potential cost reduction strategies. Fourth, we'll look at comprehensive strategy to address high-cost healthcare elements using a reduce model. Fifth, we'll develop win-win healthcare solutions for both employers and employees and their unions. Sixth, we'll gain an understanding of the cost mitigation strategies for other employee benefits, including items such as pensions, disability, life insurance, paid time off, and also retiree benefits. And finally, we'll learn about proven strategies aimed at reducing other post-employment benefit or OPEB obligations and costs related to retiree health care, life insurance, and other employee benefits. Who will benefit from this webinar? Basically any directors or vice presidents involved in human resources, labor relations, or even finance. Human resource professionals, employee benefits specialists, analytics professionals, labor relations professionals, and basically anyone involved in the union negotiations process, as well as controllers of companies. The first section we're going to look at are healthcare benefits. And before we look at that, I'd like to review the key components of all-in labor costs. As you can see on the slide, there are 4 main categories. The first one is compensation, which would include things like salaries and base wages, cost of living allowances, wage premiums such as overtime premiums, shift premiums, leader premiums, things of that nature, lump sums, whether they're things like gratification bonus or annual lump sums, variable compensation such as profit sharing, quality incentives, and attendance awards. So compensation was covered off in part 1 of this Reduce Your Labor Cost series. In this part, we have paid time off and benefits. So paid time off is things like vacations, holidays, and other time off such as bereavement, maternity, parental leaves, etc. And benefits is really the key focus of this module. We look at health care, pensions, and then other such as short-term, long-term disability, life insurance, retiree benefits, etc. And then the final component of all-in labor costs are legals. These are government-required payments for pensions, unemployment compensation, etc. So in the United States, that would be FICA, unemployment comp, and then in Canada, it would be things like Canada Pension Plan and employment insurance and employer health tax. As an introduction to healthcare benefits, I'd like to talk about the main challenge. Rising healthcare costs are arguably one of the most talked about subjects during the collective bargaining process. In most cases, it's the second largest labor cost component next to wages. However, unlike wages, healthcare costs are extremely difficult to control, especially in an environment where new, more expensive technologies and procedures, as well as new high-cost specialty drugs are being introduced on a regular basis. In the United States, companies that provide healthcare coverage for employees spend, on average, over $10,000 per employee per year. Some large employers pay more than double that, often equating to more than $10 per hour worked. So it's no wonder that groups of employers such as Amazon, Berkshire Hathaway, and JP Morgan are working together to find solutions to rising healthcare costs. Also, in Canada versus United States, Canada has public versus private funding for hospital surgical medical coverage, so healthcare benefit costs are an issue in Canada, but not quite as big of an issue as the United States. On the next slide, we'll see some other challenges which are kind of perceived union and employee guiding principles. Healthcare coverage is typically considered a sacred cow by employees and union members. And unions are in the business of protecting their members, so in most bargaining scenarios, unions will insist upon the following guiding principles, and these apply to non-union employees as well. No reduction in the employee's standard of living via increases in employee health care cost share. Want to maintain and or improve health care coverage. Want to maintain and or improve the quality of health care services. And also want to maintain employee choice. This presents a significant challenge for companies to reduce and or mitigate rising health care costs while managing these employee expectations. The good news is that there are some opportunities to do that. For those of you that have unionized employees, one of the most critical components of a solid healthcare bargaining strategy is setting the stage with the union. It's imperative that the company demonstrates the seriousness of rising healthcare costs and to clearly communicate the company's objective of controlling these costs. As noted below, it's not uncommon for companies to explicitly state that the level of new economics will be contingent upon the degree of healthcare cost mitigation negotiated. Firstly, the company should utilize data-driven analysis, including statistics on healthcare inflation trends by type of coverage, healthcare cost per employee, employee cost share, and benchmarking where appropriate to make their case. Secondly, the company should provide clear answers to the question, what's in it for the union members? Companies can be creative here. A few examples are as follows. 1. The union is looking for investment commitments in order to improve job security, while healthcare savings can be utilized to fund new investments. Secondly, healthcare savings will improve the company's bottom line financial results, so this should increase employees' profit-sharing checks. Things like that. Rising healthcare costs may preclude the company from meeting employees' current and future wage increase expectations. Healthcare coverage represents a large portion of the overall compensation and benefits package. Investment and sourcing decisions are based upon all-in labor costs. So these types of arguments can be presented to the union and to employees to encourage them to address rising healthcare costs. And finally, the company should invite the union to participate in brainstorming sessions where the two parties can generate ideas to reduce healthcare costs and or mitigate healthcare inflation. Clearly, some ideas such as cutting healthcare benefits or increasing employee cost share will not be popular with the union. However, writing these unpopular ideas on the board may encourage the union to consider less intrusive cost-cutting ideas such as modifying healthcare delivery models or plan design changes that facilitate employee consumerism. And we'll see there are a number of consumerism initiatives that have the potential to create win-win solutions where healthcare savings can be harvested while protecting the union's guiding principles noted above. So we'll take a look at a lot of these different solutions throughout this module. In order to get the most out of this module and to understand some of the solutions that are put forward, it's probably a good idea to talk about some of the definitions and concepts first before we get into the nitty-gritty. The first thing we'll talk about are the various types of healthcare coverage. Companies offer different types of coverage. The following are the most common in the United States, ranked in typical order of the total dollar spend. First is hospital, surgical, and medical coverage. Second, prescription drug coverage. Third, dental coverage. Fourth, vision coverage. And then finally, fifth, paramedical coverage. So for each type of coverage, employers and unions together must develop a detailed plan design which includes the following four key elements. 1. Coverage specifications. 2. Employee cost share. 3. Delivery models. And 4. Clinical programs. So in turn, we'll take a look at each one of these items. The first plan design consideration we'll take a look at is coverage specifications. The company must consider, or the parties must agree on numerous design elements related to each type of benefit, including the following. Extent of coverage. Questions like this would be, what specific procedures are covered under the dental plan? Dental exams, cleanings, fillings, x-rays, orthodontics, things of that nature. Secondly, limits. Are there dollar limits for certain dental procedures? Or lifetime maximums for orthodontics? Things of that nature. Frequency. Does the plan cover a dental exam once every 12 months? Or things like eligibility. It is not unusual for employees to have a 1 to 5 year waiting period before becoming eligible for benefits such as dental and vision coverage. The next major plan design consideration is the amount of employee cost share. In simple terms, employee cost share represents the cost of the employee to have and to use the healthcare plan. From an employer perspective, the employee cost share is essential to mitigating healthcare costs. In some situations with unionized environments, it's not unusual for employees to only have 5 to 10% cost share, which means that the employer is paying anywhere from 90 to 95% of all healthcare costs. Pretty significant cost. From a strategic perspective, in general, employers should strive to direct employees to low-cost delivery models via lower cost share and provide disincentives to employees via higher cost share who prefer to utilize higher cost delivery models. Unions will typically support these strategies provided that the quality of healthcare services are comparable. In addition, they'll want union members to be provided with a choice, one of their guiding principles, despite the fact that they may have to be required to pay more for it. And in general, there are 4 basic employee cost share alternatives. Most healthcare plan designs utilize a combination of these options. First one is premiums. Premiums are typically fixed dollar amounts provided by the employee to the company through regular payroll deductions. Premiums are normally scaled depending on the number of employee family members covered. For example, an employee only may be $50 per month. Employee plus spouse, $100 per month. Employee plus family, $150 per month. Premiums are considered to be intrusive by unions as they are payments to have the healthcare plan regardless of use. Deductibles, on the other hand, represent fixed dollar amounts paid by an employee before the healthcare insurance pays. Deductibles are considered less intrusive than premiums since they are only paid in the event of utilization of the healthcare benefit. From a management perspective, an advantage of deductibles is that high deductible plans often make employees think twice before utilizing healthcare benefits as they are responsible for paying 100% of the first X dollars before the company paid insurance kicks in. These deductibles are similar in nature to deductibles in your automobile or home insurance policies. The third item is copayments. Copayments or copays represent a fixed amount per service paid by the employee. Copayments are an excellent strategic tool for employers to implement in order to encourage employees to utilize lower-cost delivery models. For example, employers trying to direct employees who require non-emergent care to lower-cost family physicians may have an office visit copay of $35 versus a $100 emergency room copay for employees who elect to visit a higher-cost hospital ER. The union and management can create another opportunity for employees to demonstrate consumerism and assist the company in reducing costs. The parties can create a tiered prescription drug copayment structure. For example, generic drugs, there may be a $10 copayment, preferred brand drugs, a $40 copayment, and non-preferred brand drugs, perhaps a $90 copayment. And finally, the last alternative is coinsurance. Coinsurance is a cost-share alternative where the employee is responsible for paying a fixed percentage of the healthcare service. Coinsurance may be preferable to copayments in cases where healthcare services are highly inflationary. As an example, assume that the average cost for a drug prescription is $50, and year-over-year inflation on drugs is 10%. Assume that Company A has negotiated a prescription drug copayment of $5, and Company B has negotiated a prescription drug coinsurance of 10%. In year 1 of the contract, both companies receive the same cost share from the employee, $5 in the copayment example, or 10% of $50 in the coinsurance alternative is $5. However, in year 2 of the contract, Company B is better off than Company A as it receives a $5.50, which equates to a 10% cost share on an inflation-adjusted cost of $55. Conversely, in year 2, Company A will only receive a $5 cost share, which is only 9.1% now. So another percentage advantage of coinsurance versus copayments is that coinsurance, by its very nature, provides inflation protection for the targeted cost share and therefore may not require adjustment each contract. On the other hand, copayments may require increases in order for the targeted cost share to keep up with inflation and accordingly may need to be renegotiated every set of bargaining. In the United States, there are numerous delivery models that are available to companies either on their own in the case of on-site or near-site clinics or through their third-party benefit administrators. Traditionally, most companies utilize broad-based and/or narrow-based networks for delivery of healthcare services. A broad network is where employees have more or less unrestricted access to healthcare services available to them, subject, of course, to plan design limitations. On the other hand, a narrow network is where the scope of the network is limited in cases certain healthcare providers are excluded based on quality and/or financial metrics. Recently, in order to address rising healthcare costs, companies are utilizing alternative delivery models such as direct contracting, accountable care organizations or ACOs, on-site, near-site clinics, and telemedicine. Your benefit providers and experts can provide you with a detailed guidance with respect to the advantages and disadvantages of each of these alternatives. In many cases, savings can be realized through these alternative delivery models due to their economies of scale or by simply taking out the middleman. Direct contracting and ACOs, these delivery models are developed when the company and or third-party benefit administrators contract directly with local health systems to generate desired clinical outcomes and financial targets. On-site, near-site clinics, more and more companies are creating their own clinics, normally with a strategic partner, in order to reduce healthcare costs. The scope of these clinics range from having an on-site pharmacy to full-service clinics that offer pharmacies, dentists, family physicians, physiotherapy, etc. These clinics typically offer more convenience to employees due to the proximity to their work locations. In addition, employee cost share is lower as the company in theory should be saving money due to taking out the middleman. Some of these clinics are claiming healthcare savings of up to 30% versus the cost of traditional delivery models. Telemedicine is designed for non-emergent situations where the employee contacts a doctor via video call to discuss symptoms, and where appropriate, the doctor may be able to diagnose the patient immediately or refer them for further examination. It is considered a convenient, lower-cost healthcare delivery model. Companies should work closely with their benefit administrators to understand what delivery models are the most efficient and cost-effective for your organizations. This next chart provides an illustration of delivery model choice. As indicated previously, one of the guiding principles of the union is to ensure that employees have a choice when it comes to their health care. Therefore, it is often important that employees are given a choice, but from a company perspective, the union must understand that in order to be competitive, higher cost delivery models come with a higher cost share for employees who elect to use them. So in this example, employees have healthcare delivery model choices, but higher cost delivery models have higher cost share percentages associated with them in order to encourage consumerism. So as you can see in the chart, if you hit the bullseye, you're utilizing a low-cost delivery models such as telemedicine or on-site clinics, and in this case, cost share may be 10%. The next ring out, the white ring, moderate cost delivery models may be a narrow network where the cost share may be 20% for employees that utilize that method. And then finally, the outer ring in red represents your higher cost delivery models, which is your broad network where your cost share is 40%. Again, the advantage of this is you're giving employees choice, but it comes at a higher cost to them, but at least they have choice. The next plan design consideration we're going to take a look at is clinical programs. Clinical programs represent opportunities for companies to manage healthcare costs while maintaining or sometimes even improving the quality of care for the employee or union member. Examples of clinical programs are as follows. First one, mandatory disease management. Mandatory disease management provisions are appropriate where employers are in certain high-risk health situations, such as diabetes and heart disease, and adherence to healthcare providers' directions are critical for both positive health outcomes and cost containment. It is wise for employers to insist on this provision for certain conditions so that employees are held accountable for the high cost of treatments. Second one is drug formulary. Companies implement drug formulary provisions in order to contain rising prescription drug costs. With the drug formulary, the company is able to control what drugs are covered under the prescription drug plan. Any new drugs have to be approved in advance of being added to the formulary. Third one is centers of excellence. Centers of excellence provisions facilitate potential win-win situations for the union and management. Third-party benefit administrators are usually able to identify the hospitals with the best overall health outcomes for certain procedures in the general labor market area. Accordingly, the hospitals with the best track records for positive health outcomes are selected as the centers of excellence for those respective procedures. Heart bypass surgeries, along with hip and knee replacements, are typical examples of procedures that would be identified for centers of excellence. In theory, union members would enjoy higher quality healthcare services while the company reduces costs due to fewer complications and potential lower fees from the centers of excellence hospitals due to economies of scale. And finally, reference-based pricing provisions provide an excellent opportunity to reduce costs while satisfying the union's objectives in many cases of maintaining employee choice and quality of care. Typical procedures that are earmarked for reference-based pricing are colonoscopies as well as laboratory and radiological procedures. Right or wrong, the common denominator for these procedures is that they are all considered to be somewhat generic in the sense that the quality of care is seen to be relatively the same regardless of where the procedure is performed. Accordingly, with that said, the primary focus of reference-based pricing is on cost versus quality. This is almost the complete opposite situation approach to the Centers of Excellence concept discussed earlier. A practical demonstration of reference-based pricing is highlighted as follows. I've seen situations where the cost of hip MRIs ranged from approximately $1,000 to approximately $2,200 at several different hospitals located within the same geographical area. In this case, the union and management would negotiate a reference price for a hip MRI. The reference price is usually set at a certain percentile of the market-based cost based upon research performed by the company's third-party benefits administrator. In this example, if the reference price for a hip MRI was set at $1,400, the maximum the company would pay is $1,400. However, the employee has a choice. If he or she decides to go to the higher cost provider for $2,200, the company would pay $1,400 and the employee would be liable for the additional cost of $800. So again, respecting the employee's choice, but also respecting the fact that the company wants to control costs. And the last plan design consideration we're going to look at are cost mitigation tools and strategies. Over the years, I've learned that there are many innovative strategies and tools that can be considered in an attempt to mitigate overall healthcare costs. Some of the more common and effective concepts are as follows. Wellness programs. Wellness programs may be considered a win-win opportunity for both the union and management, or employees and management, whatever the case may be. Most wellness programs include some form of annual biomedical testing and health risk questionnaires for the employee and or their spouse. Biomedical testing often includes the measurement of the following indicators: body mass index or BMI, blood pressure, cholesterol levels, blood sugar or glucose levels. From an employee perspective, these tests are useful as they may identify health risks and or provide an early signal for chronic conditions such as diabetes and heart disease. In many cases, this early detection may provide a wake-up call to employees and encourage them to embrace a more active, healthy lifestyle. From an employer perspective, on the other hand, this potential change in employee behavior will likely translate into lower lifetime healthcare costs for these employees, whether as an active employee or as a retiree. Participation in wellness programs are normally voluntary. However, employers typically encourage employees to participate in wellness programs by either providing some sort of credits for participating or by charging them a higher cost share, for example, a higher monthly premium if they decide not to participate. The second area is smoker premiums. In the case of smoker premiums, where employees and their spouses attest that they are smokers, they are typically charged a higher cost share due to what is considered a higher health risk. Spousal surcharge. These are considered when an employee's spouse is working and has access to his or her employer's healthcare benefits but decides to opt out of their coverage, presumably to avoid paying monthly premiums. Normally, the spouse's healthcare plan would be the first payer for healthcare claims incurred personally and perhaps by their dependents, assuming the birthday rule. However, in this case, the spouse has no coverage, and accordingly, the employee's company would be liable for all healthcare claims for the spouse and dependents, assuming that the employee elected family coverage. To help alleviate these costs, many companies are now charging an annual spousal surcharge, for example, $1,000 in these cases. Pay provider versus pay subscriber. There are two basic ways for the company or its third-party benefits administrator to pay for an employee's healthcare service, namely pay provider and pay subscriber. Under a pay provider model, the healthcare provider presents a billing, net of the appropriate cost share collected from the employee, to the company or its third-party benefits administrator, and the claim is adjudicated and paid directly to the healthcare provider. Under a pay subscriber model, on the other hand, the healthcare provider bills the employee directly for the entire cost of the service. The employee, in turn, submits a healthcare claim to the company or third-party administrator for reimbursement. The claim is then adjudicated, and the amount, net of the appropriate cost share as usual, is paid to the employee or the subscriber. Unions and employees, and often even employers, typically prefer a pay provider model due to its simplicity and convenience. Employees appreciate the fact that, other than cost share amounts, there is no out-of-pocket for them, whereas they would have to wait for reimbursement under a pay subscriber model. Here's the potential opportunity. I was once told by an executive at an unnamed third-party administrator that healthcare service costs per claim were approximately 5% lower under a pay subscriber model versus a pay provider model. The executive's theory was that healthcare professionals are less likely to either fully charge or overcharge in situations where their patient is billed directly and has to pay the full amount up front. I have no evidence to prove this theory, but the rationale does seem plausible, if not interesting. For potential savings of 5%, it would seem appropriate to at least have this conversation with your benefits administrator. If this phenomenon holds true, the union may be interested in a pay subscriber model as well if there was some sort of gain sharing opportunity. Transparency tools. In this age of big data and workforce analytics, third-party benefits administrators and benefits consultants alike are in the business of providing new tools to companies in order to help manage rising healthcare costs. One of the most interesting developments are transparency tools. Transparency tools are developed by consultants utilizing historical healthcare data in particular geographic areas for many different lines of business. Employees are provided with access to this data via these transparency tools and can compare items such as costs for specific healthcare costs from one provider to the next. From an employer perspective, transparency tools have the ability to make employees better healthcare consumers, particularly when it benefits them, as illustrated in this example. Let's refer back to the reference-based pricing example that we discussed earlier. An employee who requires a hip MRI could utilize the transparency tool to see that while the reference price for hip MRI is $1,400, there are other hospitals that charge $1,000 for the same procedure. Assuming that there is a 20% coinsurance charge for this procedure, the employee could save $80 should he or she elect to go to the lower-cost hospital. Consequently, the company would save $320, creating a win-win solution for both parties. And finally, we have the concierge approach, where the employee is able to contact a phone number and talk to a concierge who then basically acts as a triage and directs the employee to the appropriate healthcare delivery model, whether it's telemedicine or to the emergency room for the proper care in order to save costs. Now I'd like to focus our attention on a simple 3-step process to reduce healthcare costs. As seen below, you can see step 1 is focus. And the way to focus is to conduct a deep dive analysis on your healthcare cost data in order to identify areas of focus. Step 2 is to drill down. Drill down on the areas of focus in order to identify specific high-dollar items such as medical conditions, delivery models, procedures, or groups of employees that require attention. The key here is to utilize stratification tools and analyze by type of procedure, by service provider, by employee, etc. And we'll see that the 80-20 rule often applies. That is, 20% of the employees' procedures drive 80% of the costs. And as always, we must always respect employee privacy laws. Step 3 is to develop solutions. And we'll develop potential solutions to address the high-dollar items identified in the areas of focus above. And we've seen previously that there are multiple plan design modifications, strategies, and tools to work with here, and we'll look at some examples of those. So let's focus more on step 1. This is the area of focus. The purpose of utilizing analytical tools is to break down the company's healthcare spend by type of benefit and then to drill down into details as required in order to determine which areas to focus on during bargaining or when designing plans. One of the most powerful analytical tools is stratification. By stratifying healthcare costs by type of benefit and looking at year-over-year inflation, management can quickly assess where to focus their efforts. This table is a good illustration of that. After looking at the table, one can easily see that the primary focus should be on hospital surgical medical coverage, since it represents 70% of the overall healthcare spend. Prescription drugs should be the secondary focus, not only since it's the second highest spend, but also due to the 10% year-over-year inflation rate. So at this point, we should further stratify and drill down on each of these two focus areas, hospital surgical medical and also prescription drugs. So let's look at step 2, the drill down step. There are really endless opportunities that can be gleaned by drilling down on the data. For example, hospital surgical medical costs. The company should be asking the following questions. Are a significant amount of costs related to chronic conditions, and if so, are employees seeking appropriate treatment? How much of the healthcare spend is attributable to colonoscopies, laboratory, and radiological procedures? Are employees going primarily to the high-cost delivery providers? Is utilization in the emergency room high? Drill down to see if there are employees who are frequent flyers or situations where employees are visiting the emergency room for non-emergent care. For focus area number 2, prescription drugs, the drill down the data may identify the following types of high-cost areas: specialty drugs, lifestyle drugs such as erectile dysfunction drugs. So now we move on to step 3, develop solutions. So for focus area 1, hospital, surgical, medical, you can see examples of potential solutions here in red. For chronic conditions, if employees are not seeking appropriate treatment for things like heart disease and diabetes, perhaps mandatory disease management is a potential solution. Where employees are constantly going to the high-cost providers for laboratory and radiological procedures, perhaps reference-based pricing is a potential solution. And if you have employees that are frequent flyers and are going to an emergency room for non-emergent care, perhaps increasing employee cost share is a potential solution, or implementing telemedicine or concierge approach. Those types of things may be solutions for that. Looking at focus area 2 for prescription drugs, if your specialty drug costs are increasing significantly, maybe consider looking at step therapy. And if your lifestyle drug costs are increasing significantly, maybe it's time to increase employee cost share or limit or maybe even eliminate coverage for certain types of drugs. So in summary, this 3-step approach can be very useful for employers. Data analytics can provide tremendous insight into where to focus your attention. However, employers must be careful not to violate any confidentiality laws, for example, HIPAA in the United States. But if possible, it is very useful if third-party consultants can aggregate data for these high-utilization employees or high-cost procedures in order to highlight trends and opportunities so that you can reduce your costs. This next slide illustrates the reduce model that I developed. It basically consolidates all the concepts and strategies that we've talked about already. So the first one is reduce. R is review healthcare plan designs and consider modifications to plan coverage specifications. For example, tightening eligibility rules. The E is employee cost share. Minimize intrusiveness by focusing on employee consumerism. Things like generic versus brand name drugs. Encourage employees to act as good consumers. D is delivery models. Consider and encourage less expensive alternatives where possible. For example, utilize telemedicine versus going to the emergency room. U is utilize clinical programs to help manage costs while striving to maintain quality of care. Put together a reference-based pricing program. Encourage employees go to the low-cost provider where possible. C is cost mitigation tools and strategies. Take advantage of these opportunities. Things like transparency tools, other models that we talked about. E is examine opportunities to mitigate retiree healthcare obligations. Take a look at using a defined contribution versus a defined benefit approach. We're going to talk about this a little bit later in more detail. Next, we're going to look at a couple of union bargaining strategy tools. We'll review a couple of tools that can be helpful in formulating bargaining strategy with respect to healthcare benefits. These tools will assist management in identifying areas of focus as well as helping to handicap the likelihood that the union will accept management proposals. The tools that we reviewed are as follows. 1, potential cost savings versus employee intrusive matrix. And 2, we're going to look at the utilization of stratification and analytical tools. That's one of the things we've already kind of touched on. First, we'll look at potential cost savings versus employee intrusiveness matrix. The purpose of this tool is to identify potential cost saving initiatives related to healthcare benefits and to assist in making a strategic assessment of where to focus negotiation efforts. For ease of analysis, the initiatives are juxtaposed on a simple matrix and are analyzed based on the following 2 criteria. 1, potential cost savings on a continuum of low to high, and employee intrusiveness on a continuum of low to high. Logically, management will want to pursue opportunities where potential cost savings are high, and union will be less willing to listen to ideas where employee intrusiveness is high. For example, a proposal to introduce or increase monthly premiums would be considered highly intrusive to employees, and accordingly, the company should expect a higher resistance from the union versus a less intrusive proposal, such as introduction of an employee wellness program. This simple matrix is for illustration purposes only. Once again, the purpose of the matrix is to assist with strategy formulation. Many questions need to be asked. For example, are significant increases in monthly premiums worth the fight? Or should the company go after reference-based pricing and mandatory care management instead? Doesn't mean that you can't do any increased monthly premiums, but maybe not to the same extent that you'd like to. What combination of initiatives will help us achieve our targeted healthcare savings while minimizing employee intrusiveness? Wellness programs do not offer significant immediate savings, but could offer significant long-term savings with minimal resistance expected from the union. Should we go after it? We've already touched on the second bargaining strategy tool, which is stratification charts and analytical tools. And in the illustrative chart, you can see we've already looked at it, but the real idea here is to focus on the high cost items and the items that have high year-over-year inflation rates. The last area we're going to talk about under healthcare benefits is retiree healthcare. Companies that offer retiree healthcare coverage are typically saddled with significant other post-retirement employee benefit or OPEB balance sheet liabilities that have a high degree of uncertainty surrounding them. In addition, from an accounting perspective, these defined benefit plans attract annual accounting charges such as service and interest costs, and these retirement-related costs must be accrued over the employee's active career. The uncertainty surrounding these future liabilities due to high medical inflation, coupled with the fact that people are living longer, has made retiree healthcare coverage much less popular. Today, it appears that retiree healthcare coverage is far more prevalent for employees in the public sector versus the private sector. For the most part, unions have resisted the elimination of retiree healthcare coverage for existing employees. Therefore, in most cases, current employees are grandfathered in to the retiree healthcare coverage. Many unions do, however, recognize that the provision of retiree healthcare coverage will be unsustainable for all current and future employees. Accordingly, many unions have negotiated the grandfathering of retiree healthcare coverage for current employees, along with the defined contribution formula in the form of a 401k savings plan contribution in lieu of retiree healthcare coverage for future new hires in the United States. While this approach may not be considered a perfect solution for employers, it does address the uncertainty aspect of the obligation for future new hires from a certain point forward. In addition, from a ratification perspective, this approach is typically approved by union membership as they are not directly impacted due to the grandfathering provisions. Again, this is because future new hires are not there to vote yet. As an example, during 2007 negotiations with United Automobile Workers, the Detroit Three, that is GM, Ford, and Chrysler, negotiated a defined contribution approach with respect to retiree health care for future new hires. So from that point on, any new employees hired on or after the commencement of the 2007 agreement receive a $1 per compensated hour contribution into a 401k savings plan in lieu of retiree health care. Also, in certain catastrophic situations, such as a significant industry downturn or looming bankruptcy, unions have been willing to accept a transfer of the retiree health obligation from the company to a union-sponsored trust. I was personally involved in such a transaction during 2007 when Detroit 3 negotiated a full transfer of their retiree health care obligations to a United Automobile Workers Trust. Now, these transactions are extremely complex and require the coordination of negotiators, accountants, actuaries, and lawyers from both the union and company. So in summary, the strategies we talked about really to reduce costs for retiree health care is you can reduce and or eliminate certain benefits or increase retiree cost share, and also the defined contribution approach for future new hires while your existing employees are grandfathered. And thirdly, it's more complex, but you can transfer existing OPEB obligations to union-sponsored healthcare trusts. So in summary for this section on healthcare benefits, healthcare is a high-cost yet underappreciated employee benefit, and therefore employers must continue to communicate the value and cost of healthcare to employees regularly. There are numerous opportunities to mitigate and or reduce rising healthcare costs. As we've seen, plan design is extremely important. Remember the example of co-insurance versus co-pay. There are savings there. Also, alternative delivery models do exist. Direct employees to lower cost alternatives via lower employee cost share and vice versa. Utilize clinical programs and cost mitigation tools to help manage costs. Stratification analysis of your healthcare data can help focus your attention on what matters most. As you've seen, win-win solutions are possible with unions, Employee consumerism initiatives can significantly reduce costs, perhaps allowing companies to maintain existing healthcare coverage, continue to provide employees with choice, and potentially fund new economics in the contract as a quid pro quo. And finally, future new hires may represent the most likely opportunity for change, as current employees often need to be grandfathered in to ratify the agreements. The next major topic in this webinar is pensions and other employee benefits. As an introduction, pension and other employee benefit costs represent a significant component of the total cost of labor. So in this module, we're going to look at numerous strategies that can be utilized to reduce the following types of costs: pensions, short-term disability, long-term disability, life insurance, retiree benefits, and paid time off. First, we'll take a look at pensions. As mentioned earlier, next to wages, healthcare benefits tend to be the primary focus of economics bargaining, especially in the United States, where healthcare is for the most part privatized. In terms of focus, pensions are likely the next most important discussion topic. However, in jurisdictions such as Canada, where healthcare is largely publicly funded, pension discussions often take precedence over healthcare discussions. So first we'll compare and contrast defined contribution versus defined benefit pension plans. Pension plans are generally divided into two types, namely defined contribution plans and defined benefit plans. Both types of plans have their pros and cons, but in general, defined contribution plans are preferred by employers and defined benefit plans are preferred by employees. Defined contribution plans, the employer contributes a set amount of money into an employee's specific retirement account each pay period. The employee is solely responsible for investment returns, therefore the financial risk is clearly on the employee. In many cases, employees are required to make contributions as well in order to receive the employer contribution. Upon retirement, the employee can withdraw any contributions plus investment earnings. One advantage to employees is that they have control with respect to the amount and timing of pension withdrawals. From an employer perspective, their only financial obligation is to make the contribution to the employee's retirement account each pay period. Accordingly, the employer is not required to carry on long-term pension obligations on its balance sheet. For these reasons, employers generally prefer the defined contribution plan approach. Defined benefit plans. In contrast to a defined contribution plan, a defined benefit plan places the financial risk on the employer. The employer basically commits to pay the employee a predetermined amount, whether it is defined as a percentage of salary or flat dollar amount, upon retirement for life. The employer is typically required to make contributions as determined by actuaries to a company-sponsored pension fund. Employees are generally required to remain with the company for a certain time period before their pension entitlements vest, and employees are sometimes required to make contributions. The employer assumes any risk associated with investment returns on plan assets, employees living longer than expected, etc. In addition, the employer must account for any pension obligations on its balance sheet. It is not uncommon for employees to receive more than 50% of their pre-retirement employment income in the form of a pension when they retire. A typical defined benefit formula may provide a pension benefit of anywhere from 1.5% to 2% per year of service. Therefore, an employee who works 30 years with a 2% formula per year of service would replace 60% of his or her pre-retirement employment income. One advantage to employers with this type of plan is that it improves retention, as it encourages employees to remain with employers in order to maximize pension benefits. From a union bargaining planning perspective, in situations where companies have defined benefit pension plans, unions generally have target replacement ratios in mind when they are negotiating pensions. As an example, prior to negotiations, where employment income is $5,000 per month and there is a flat dollar pension of $3,000 per month for new retirees, the target replacement ratio in this case would be calculated as 60%, 3,000 divided by 5,000. If the union is looking for 10% wage increases over the life of the contract, one should expect that the union will expect a corresponding increase in the pension amount for future retirees, potentially bringing the flat dollar pension to $3,300 per month. From an employee perspective, a defined benefit pension plan structure is generally preferred, as the employee and sometimes their surviving spouse will receive some level of guaranteed pension benefits for life. The most significant risk to the employee is in the event that the pension plan becomes insolvent, for example in the case of bankruptcy of the employer. This risk is somewhat mitigated by the existence of any pension benefit guarantees from the government. I'd like to talk about some recent trends with pensions. Over the past decade or so, companies have been moving away from defined benefit pension plans in favor of defined contribution plans for both unionized and non-unionized employees. Companies are attempting to de-risk their balance sheets and to remove some of the volatility from their earnings by replacing risks associated with interest rates, investment returns, and mortality assumptions with more predictable pension expenses under defined contribution plan designs. These trends in pensions are similar to the trends that are occurring with other post-employment benefits such as retiree health care, as discussed earlier. There are a number of strategies in addressing defined benefit pension plans. Employers can implement to mitigate the effects of any existing defined benefit pension plan and or transition their workforce to a defined contribution pension plan design over time. Three of the more common strategies are presented as follows. The first strategy we'll talk about is to, number one, close defined benefit pension plan to new entrants. This is likely the most common approach. In general, the union and management in a unionized setting would agree to retain the existing defined benefit pension plan for current employees. However, any future new hires will be covered by a defined contribution pension plan. The advantage of this approach for both the union and management is that it is relatively easy to ratify, as current employees are grandfathered into the defined benefit pension plan and are unaffected by the transition to a defined contribution pension plan design for future new hires. From an employer perspective, the disadvantage of this approach is that there is little immediate impact on the overall financial risk of its pension plan unless the company has significant hiring plans in the near future. On the other hand, over the long term, this approach will fully transition to a defined contribution pension plan design in the future. This approach was agreed to and implemented by the Detroit 3 automakers and the United Auto Workers Union as part of their 2007 bargaining agreement. The second strategy we'll talk about is number two. You'd freeze the defined benefit pension plan. In this scenario, assuming that the defined benefit plan is closed to new entrants and future new hires would be covered by a defined contribution pension plan. However, in this case, certain aspects of the defined benefit formula, namely the years of service and or benefit rate, are frozen for employees who are already covered by the defined benefit pension plan design. There are two main types of freezes, namely a hard freeze and a soft freeze, as described next. A hard freeze occurs when the company freezes both elements of the defined benefit formula. At a certain point in time, both the employee's service and the benefit rate are frozen. This is the preferred approach from an employer's perspective, as two of the largest inputs in the actuarial liability calculation are known at the time of the freeze. For example, if the defined benefit formula provides for a monthly pension based on $60 per year of service, an employee with 20 years of service at the time of the freeze will have a known pension of $1,200 per month upon retirement. After the freeze, employees' future service is typically covered by a new defined contribution pension plan, usually similar to what you're doing with the future new hires. A soft freeze occurs when the company freezes one of the elements of the defined benefit formula. In one scenario, employers will freeze the years of service while allowing the benefit rate to escalate over time as wages and salaries grow, assuming it's based on a percentage of salary. After the freeze, employees' future service is typically covered by a new defined contribution pension plan, similar to what we talked about above. This is common in scenarios where the benefit rate is based on final average salaries. In the other scenario, employers will freeze the benefit rate while allowing employees to accrue future pension-credited service. While there are no formal pension freeze agreements in place with Detroit 3 automaker unions in the United States and Canada, employees covered under defined benefit pension plans have not received a benefit rate increase in their pension for over a decade, which has in effect created somewhat of a soft freeze scenario. In a benefit rate freeze scenario, one would expect that any future pension improvements would be in the form of a defined contribution plan design. From an employer perspective, a soft freeze is not as advantageous as a hard freeze, but it does help mitigate the risks associated with defined benefit pensions, while facilitating a transition to a defined contribution model. In addition, it may assist in the retention of employees, as by remaining with the company, employees may have an opportunity to increase their defined benefit pension via either benefit rate improvements or additional credited service, while receiving defined contribution pension amounts for future service. The third strategy is the hybrid approach. This hybrid approach is a bit of a compromise. The hybrid approach retains an element of the defined benefit pension plan, typically at a reduced benefit rate, while supplementing the defined benefit shortfall with a defined contribution pension formula. In effect, a hybrid plan design facilitates the sharing of financial risks between the employer and employee. I'm familiar with a company that redesigned its defined benefit pension plan for future service as follows. Before the change, they had a pure defined benefit pension plan, and the defined benefit formula was basically 2% per year of service times final salary. And after the redesign, it was a hybrid defined benefit / defined contribution pension plan. The defined benefit formula was changed to 1% per year of service times final salary, plus a defined contribution formula, which was effectively a 100% savings plan match and employee contributions up to a maximum of 3% of salary. So in this example, the employer mitigated the risk associated with future service related to a defined benefit pension plan by reducing the benefit rate from 2% to 1% per year of service times final salary. In addition, the employer also insisted employees have some skin in the game by requiring them to contribute to their pension plan prior to matching their contributions. So in this case, it was a bit of a compromise. Both parties have some financial risks associated with it. I'd like to talk a little bit about the union acceptance of changes or modifications to pension plans. Similar to healthcare, pension plans are often seen as sacred cows by unions, and accordingly it may take several sets of bargaining to convince a union to move to your ideal state, which may in fact be a defined contribution formula. As an example, it took several sets of bargaining for the Detroit 3 automakers to convince the Canadian Auto Workers Union, or Unifor, to change their pensions for new hires from a pure defined benefit pension plan to a defined contribution pension plan. And here's the timeline. The 2008 agreement between the Detroit 3 automakers and the Unifor had defined benefit pension plan, pure plan with no employee contributions. Then in 2009, there was a special agreement as GM and FCA were going into bankruptcy, and they changed from a pure defined benefit pension plan with no contributions to they retained the defined benefit pension plan but required $1 per hour employee contributions for any future new hires. Then it wasn't until 2012 that they created a hybrid plan, which was a combination of defined benefit and a defined contribution pension plan. And then finally, it wasn't until 2016 that the union moved to a defined contribution pension plan for all future new hires. Therefore, it's imperative prior to bargaining that employers establish a migration strategy with fallback positions if they want to have success in making substantive changes to plan designs. There are also some other strategic opportunities that can be implemented to mitigate the costs and the risks associated with employer-provided pension plans. A few of these will be highlighted next. First one is employee contributions. When employers provide a defined benefit pension plan, the introduction of employee contributions or even an increase in existing employee contributions can provide a significant decrease in the employer's cost of the program. Also, there are opportunities with pension cost of living allowance, or also known as PCOLA. Some defined benefit pension plans have cost of living adjustments provisions inherent in the plan design. The PCOLA formula is typically linked to a widely recognized consumer price index. These provisions are quite expensive as the company's actuaries are required to account for future pension benefit payment increases as a result of projected inflation. There are opportunities for significant savings for employers to the extent that they can either eliminate PCOLA or modify the PCOLA so that it is either capped, for example at a 2% inflation rate, or paid only in the event that inflation exceeds a specified threshold. For example, inflation that exceeds 2% will be covered. Many employers have been successful in eliminating PCOLA provisions over the past decade or so. In many cases, this has been the quid pro quo from the union for the company's commitment to retain defined benefit pension plans for other union members. Also, minimum age for retirement is another opportunity. Many employers have defined benefit pension plans that allow employees to potentially retire at what may be considered a very young age once the employees have a certain amount of corporate service. These plan designs can be very expensive, as the employer may be on the hook for pension payments to individual retirees for 30, 40, or even 50 plus years in extreme situations. For example, in the United States, Detroit 3 auto workers hired prior to 2007 UAW contract have a defined benefit pension plan that has a 30 and out provision. In this case, employees can retire with a full pension after 30 years of service, regardless of age. Therefore, in theory, an employee hired at age 18 can work for 30 years and then retire at age 48. If the employee lives past age 78, the retiree will have collected a pension for longer than the person was an active employee. In situations like this, a company can achieve significant savings by negotiating a minimum age for retirement. In the example above, a minimum age of 55 would eliminate the need to account for up to 7 years of pension payments. That is 55 minus age 48 for those employees that the actuaries predict will retire before age 55. This will result in a reduction in pension expense as well as a reduction in pension liability on the company's balance sheet. However, we must keep in mind that the majority of employees typically work beyond age 55 since they are not ready to retire yet for any number of reasons, including financial obligations such as outstanding mortgages, children in university, etc. Nonetheless, there are savings opportunities as some number of employees should be expected to retire prior to age 55. From a bargaining perspective, employers considering this approach should work with their actuaries to model potential cost savings at various minimum age thresholds. Obviously, the company will like a higher minimum age, such as age 60, in order to maximize savings, while the union may only consider a minimum age of 50 to 55 in this case, in order to minimize the intrusiveness on their members. In order to build a case for a presentation to the union, management should be armed with as many statistics and arguments as possible. For example, if management is looking for a minimum age of 55, perhaps a couple of good points to present to the union are as follows. The average age of retirement is age 58, so you're not going to affect that many people. Or maybe something like only 15% of employees actually retire before age 55, therefore this should not present a significant issue for ratification. Or a minimum age threshold may be the quid pro quo required for the union to retain their defined benefit pension plans for everyone. Again, the company should not expect the union to embrace a high minimum age threshold during the first set of negotiations where management presents this concept. Therefore, management should develop a reasonable migration strategy, as it may take a few rounds of bargaining to get your foot in the door and to get the desired minimum age threshold. Accordingly, management should try to get a foot in the door first during the current set of negotiations, and if the concept is accepted by the union, attempt to increase the minimum age threshold during subsequent collective bargaining sessions. Another opportunity is to link pension entitlements to attendance. In order to encourage attendance where possible, employers should link pension entitlements to attendance. For example, the defined contribution formula may be constructed as 6% of compensated pay. From an employee perspective, employees would receive a company pension compensation for all straight time hours worked, overtime hours worked, as well as for paid time off such as vacation and holidays. From an employer perspective, the company would not have to make pension contributions to employees for any unpaid or casual absenteeism. Another item I'd like to talk about are just demands for current retiree pension increases. Unions often demand pension increases for existing retirees, especially when a large part of the retiree population is receiving pension benefits that are significantly lower than the pensions for new retirees. These retirees generally do not have PCOLA provisions, and it becomes increasingly difficult for them to maintain their standard of living due to inflation. Formal pension rate increases for current retirees would increase the company's pension obligation and drive costs higher well into the future. Therefore, where required, some companies have negotiated other forms of compensation for current retirees that span the life of the current agreement only. In the automotive industry, alternative forms of compensation for retirees has ranged from lump sum cash payments to prepaid credit cards to vouchers for new vehicle discounts. From a strategic perspective, when pressed by the union to take care of the retirees, it may be prudent to remind the union of the following two important realities. One, there is only so much money in the company budget for new contract economics, and if you spend it on retirees, there is less budget available for active employees. Always a good argument. And two, retirees do not vote on the new contract, active employees do. So as you can see, there are a lot of strategies available to reduce pension costs. Next, we're going to turn our attention to other employee benefits. There are a number of other employee benefits that are subject of collective bargaining and are provided by non-union employers as well. The most common ancillary employee benefits include items such as short-term and long-term disability as well as life insurance. In addition, coverages are often negotiated for semi-private hospital rooms and paramedical services such as chiropractor and physiotherapy treatments. There are a number of key points to take into consideration when designing these types of plans, including the nature and extent of coverage. Who's eligible? Employee, spouses, dependents? What are the dollar amounts and limits of the coverage? What is the duration of coverage? Also, are there any waiting periods before the commencement of coverage, for example, S&A waiting periods? Are there any cost-sharing arrangements? Are there requirements for medical substantiation, for example, with sickness and accident and disability claims? And also, will retiree coverage be provided? From a strategic perspective, there are a number of opportunities to either establish or modify plan designs in order to potentially reduce your overall labor costs. Examples are as follows. Short-term disability. You can reduce the maximum duration for receiving short-term disability benefits. For example, reduce the maximum duration from 52 weeks down to 26 weeks. You can increase the waiting period from, say, 3 days to 5 days. In theory, fewer employees will file for short-term disability benefits if the waiting period is increased. In the United States, the company should insist that short-term disability leaves are accounted for concurrently with Family Medical Leave Act, or FMLA leaves, as allowed under the federal legislation. From a time-off perspective, this will assist in preventing pyramiding of medical leave entitlements. Long-term disability. The duration of long-term disability leave should be capped in order to avoid paying benefits out indefinitely. A common approach is to cap the duration of benefits under what is commonly referred to as a time-for-time concept. This concept essentially caps the duration of long-term benefits to the employee's years of service with the company. With life insurance, many coverages are based upon 2 times or 3 times earnings, which have an inflationary effect. Those can be traded off for flat dollar amounts that may save some cash. One of the greatest strategic opportunities exists with retiree benefits. In particular, you can establish caps where appropriate. The company must account for retiree benefits throughout the employee's career. Accordingly, there is an annual accounting charge to the profit and loss statement of the company to account for these benefits. In addition, a company must record both the retiree benefits accrued for active employees to date, plus the corresponding liability for existing retirees on its balance sheet, which is considered the OPEB obligation. Without getting too technical, the annual accounting charge includes a service cost plus an interest cost that is calculated on the OPEB obligation. So this OPEB obligation is basically the actuarial present value of the anticipated future cash flows associated with the various streams of retiree benefits. And typical retiree benefits may include health care, life insurance, and coverages for other items such as semi-private hospital rooms or long-term care. These are becoming more and more popular as the population ages. Actuaries must project future utilization and cash flows for each benefit type. So in an extreme case, for a new 20-year-old employee, the actuaries may need to project the cost of certain retiree benefits with inflation out 80 or more years if such employee is expected to live to 100 years of age. If coverage values are uncapped, as you can imagine, the compounding effects of inflation create significant OPEB obligations and corresponding annual accounting charges for employers. The cost of benefits in 80 years will be exponentially higher than today. This is where the strategic opportunity presents itself. The company can significantly reduce both its expenses and OPEB obligation on the balance sheet by capping benefit rates in order to mitigate the impact of future inflation. From a strategy perspective, this approach has merit when management is adamant about negotiating cost reductions and or when the union is demanding significant economic improvements and management requires cost offsets. Firstly, management must be able to demonstrate the significance of the impact of such a change on the company. This can be accomplished through the assistance of the company's actuaries. Next, the company and union must negotiate a reasonable cap. At a minimum, the union will want to negotiate a cap that is in excess of the anticipated inflation-adjusted value over the term of the new agreement. In addition, both parties must anticipate that the cap will be up for renegotiation during the next round of collective bargaining. In the meantime, this strategy can create a win-win solution as the company will enjoy significant financial savings due to the cap, while union members and retirees are unaffected to the extent that costs do not exceed the cap over the course of the agreement. As an example, in 2012, Ford Motor Company negotiated a cap on long-term care for retirees during national bargaining with Unifor in Canada, resulting in significant savings for the company. As an example, if you assume that you have long-term care coverage for your employees, and if today the value of long-term care is $4,000 per month, that's the cost, and annual inflation is projected to be about 5%, at the end of the 3-year agreement, the cost would increase about $200 each year, so it would be slightly higher than $4,600. The strategy here would be to set a cap that's in excess of the $4,600, say at $5,000, which is higher than it would be by the end, projected to be at the end of the agreement, but would be significantly less than if it was projected out 80 years from now. There could be significant reductions in the OPEB liability, service costs, and interest costs on the obligation in this case. Paid time off is another benefit that is relatively important to employees. Therefore, a generous paid time off policy can be an excellent tool to assist in the attraction and retention of top talent. Paid time off is one of those benefits that are typically negotiated in the very first collective agreement if you're unionized, and then more or less tweaked in subsequent agreements if required. It's not unusual for unions to ask for an additional holiday or inclusion of a new type of paid time off for less common forms of absence such as jury duty leave. In each case, prior to granting these requests, the company must determine the anticipated cost of these demands. In assessing the potential cost, employers must assess the expected utilization of any proposed modifications to paid time off provisions, along with the estimated cost to replace the employee for the absence. So employers should anticipate demands for incremental paid time off and work with their finance teams in advance of bargaining to cost out scenarios such as the cost of an additional holiday, etc. There are numerous types of paid time off that may be subject to bargaining or part of your non-union environment, including the following. Holidays. At a minimum, by law, the company must provide for statutory holidays such as Christmas and Easter. However, many collective bargaining agreements in the automotive sector provide for an average of 15 to 16 holidays per year. Vacation. Vacation entitlements are typically graduated based on length of service with the company. Many companies split this form of paid time off into two categories. One that is designed for full weeks off, and another that is intended for short-term utilization, allowed perhaps in half-day or full-day increments. These paid short-term absences typically require approval in advance or should require a minimum call-in notice, for example, an hour before the start of the shift, in the event that this type of leave is utilized for casual illness. Things like bereavement, jury duty, and military leaves. Employers often provide for these types of paid leaves. Initially, the biggest challenge in granting these types of leaves is estimating the projected utilization of these leaves by employees and accordingly estimating the potential labor costs associated with them. Employers must clearly define the parameters surrounding these types of leaves. For example, in the case of paid bereavement leave, the following parameters should be addressed. Eligibility. Are employees entitled to bereavement leave from date of hire? Is bereavement leave allowed for the death of someone in their immediate family only? And what is the definition of immediate family? Duration. Are employees allowed 4 days of paid leave for immediate family and 2 days of paid leave for others such as aunts and uncles? These types of things have to be ironed out. Proof of claim. What documentation is required to support the claim? Are employees required to attend the funeral? These are all questions that should be asked and documented as part of the policy. Also, you have maternity, parental, and adoption leaves, which are becoming more and more influential in attracting and retaining top talent. Similar to the other leaves, specific parameters must be negotiated, especially with respect to amounts and duration of benefits. It's important that these leaves are designed with clearer consideration of what is provided by government-sponsored programs such as unemployment insurance in terms of payment amounts and duration of benefits. Any company payment should be in the form of a top-up to any government-sponsored benefits where practical. There are a number of opportunities from a strategic perspective with respect to paid time off that can assist the company in both reducing labor costs and addressing high absenteeism. A few concepts are noted as follows. Can tighten eligibility rules. Any improvement in the form of tightening eligibility rules pertaining to paid leave should assist in reducing costs. Also, where possible, link vacation eligibility to attendance. Companies should attempt to link vacation eligibility in any given year to either attendance or hours worked. In the automotive industry, it is not uncommon for hourly employees to receive full vacation entitlements while only being required to work in 26 weeks of the year. That's 50%. In this case, there are opportunities to either increase the minimum number of weeks required to obtain full vacation entitlements, for example, require 39 weeks versus 26 weeks, or alternatively to prorate the vacation entitlements to the number of weeks worked. In this case, perhaps an employee working 39 weeks in a prior year would be entitled to only 75% of their vacation entitlement. Also, Family Medical Leave Act, or FMLA, leaves should be concurrent with paid time off. Through discussions with colleagues from various industries in the United States, FMLA misuse is a common concern when discussing situations where companies are experiencing high absenteeism. In the United States, FMLA legislation allows for employers to charge FMLA leaves against vacation entitlements. Many FMLA consultants suggest that the single largest deterrent to FMLA misuse is to charge employees vacation entitlements on a time-for-time basis as they utilize FMLA. In theory, employees may think twice before utilizing FMLA if they know upfront that they will be utilizing vacation time as well. Therefore, it's highly recommended that employers reduce employee vacation entitlements concurrently as they utilize leaves under the Family Medical Leave Act. The last item I'd like to talk about is The effects of newer proposed government legislation. Governments in the United States and Canada are introducing newer proposed legislation for paid sick leaves and paid emergency leaves. In Canada, Ontario recently passed legislation that requires certain employers to pay employees for the first 2 days of any personal emergency leave. In the United States, the federal government has recently proposed legislation to support paid sick leaves. It's not unusual for unions to demand additional paid time off as a result of these new statutory leaves. Therefore, from a strategic perspective, when employers already have a generous paid leave structure in place, it may be prudent to highlight to the union some of these points. New legislation for paid leaves is often intended to provide relief to employees who are working for employers who only provide the bare minimum in terms of statutory paid time off. Remind them of the generous leave policies that you have. Also, management should illustrate that the company's existing paid off structure already exceeds statutory requirements. So for this section on pensions and other employee benefits, in summary, there are numerous opportunities to mitigate the costs associated with pensions and other employee benefits, as we've seen. Shifting from defined benefit to defined contribution approaches, for example in pensions, capping liabilities. For pensions, you can freeze strategies. You've got elimination or modification of pension cost of living allowances. You can cap liabilities for things like long-term care. Also, there's value in modifying benefit eligibility requirements. And also there's value in linking benefit entitlements to attendance to help your absenteeism issues and to help reduce costs. Thank you for taking the time to participate in our on-demand webinar today. I am pleased to inform you that HR and Labor Guru has 3 distinct on-demand webinar series with a total of 7 modules as follows. First, we have the Reduce Your Labor Cost series, and there are 2 modules in this series. Secondly, we have the Bargaining Preparation series, and again, there are 2 modules in this series. And finally, we have the HR Analytics series, and there are 3 modules in this particular series. I would like to take a few minutes to talk to you about the content in the respective series. In a few instances, certain strategic concepts are introduced at a high level in one module, and then for those of you who are interested, presented in a deeper dive format in another module. I will attempt to highlight these situations as I quickly walk you through the module highlights. First, let's talk about the Reduce Your Labor Costs series. These modules will appeal to anyone interested in reducing their labor costs, whether you're an HR or labor professional looking to redesign your compensation and benefit plans, preparing for negotiations with the union, or simply a corporate controller looking for opportunities to reduce labor costs. Part 1 of the Reduce Your Labor Costs series deals with compensation and workforce composition. In this series, you'll develop an in-depth understanding of the numerous financial elements that should be considered when calculating all-in labor costs. Also, you get an understanding of several internal and external factors to take into consideration when contemplating modifications to compensation. Also, compare and contrast employee or union versus company preferences with respect to compensation alternatives, to recognize strategic opportunities to offer lump sums and or variable compensation versus fixed wage increases. And finally, in this module, you'll obtain a clear understanding of how changes to a company's workforce composition can be one of the most union-friendly opportunities to significantly reduce and or mitigate rising all-in labor costs over time. In contrast, Part 2 of the Reduce Your Labor Costs series deals primarily with healthcare, pensions, and other employee benefits. In this module, you'll gain an appreciation for the importance of plan design decisions in driving overall employee healthcare costs. You look at things like employee cost share, delivery models, and clinical programs. Also, you look at the identification of the multiple levers, strategies, and tools available to mitigate rising healthcare costs. Also, we'll take a look at a 3-step analytical approach to identify key focus areas in order to facilitate potential cost reduction strategies for healthcare. And also, we'll have a comprehensive strategy to address high-cost healthcare elements using a reduce model. And we'll also take a look at developing win-win healthcare solutions for both employers and employees or their unions. In addition, you'll understand cost mitigation strategies for other employee benefits, including pensions, disability, life insurance, paid time off, and retiree benefits. And finally, learn about proven strategies aimed at reducing other post-employment benefit obligations and costs related to retiree benefits. Secondly, let's talk about the Bargaining Preparation and Strategy Formulation series. These modules will appeal to anyone looking for practical guidance relative to preparing for bargaining with the union, whether you're a member of the actual negotiations team or a member of one of the support teams, such as finance or public relations. Most of the content, particularly with respect to strategy formulation, will appeal to all levels of an organization, including directors and vice presidents. Part 1 of this series is called Bargaining Preparation. This module outlines the key negotiations preparation activities that should be performed from 12 to 18 months in advance of bargaining right through to opening day. The key areas of focus for bargainers typically include the following: a bargaining environment assessment, development of a robust internal governance process, development of negotiations costing models, formulation of bargaining strategy, and finally, creation of a comprehensive communication strategy. And all of these elements are dealt with in this module. While negotiations, costing models, and strategy formulation are presented at a high level in Part 1, for those of you interested in more of a deep dive, I would highly recommend looking at Part 2 in this series as well. Part 2 is called Negotiations, Costing Models, and Strategy Formulation. In this module, you'll develop an in-depth understanding of the numerous financial elements that should be considered when calculating all-in labor costs and creating negotiations costing models. You'll also obtain a clear understanding of how to develop a dynamic cost model by utilizing a simple 3-step approach. In addition, you'll learn how to develop practical bargaining tools that can be utilized to improve efficiencies when costing out union demands and management proposals, develop alternative economic offers, and assist in formulating overall bargaining strategy. As well, you'll learn how to develop a simple matrix that will assist the company in identifying potential win-win solutions with the union. And finally, you'll understand the importance of developing a comprehensive economic offer playbook by consolidating input from the various subcommittees. And finally, let's talk about the HR Analytics series. These modules will appeal to a wide variety of professionals, including those in the analytics, finance, HR, and labor relations fields. Part 1 of this series is entitled Building a Value-Added HR Analytics Function. In this module, you'll take a look at the structure, roles, and responsibilities of an effective HR Analytics team. We'll also talk about how to address common challenges that companies face in growing their HR Analytics function. We'll identify quick wins and value-added projects that will appeal to both HR business partners and HR centers of excellence. And finally, we'll take a look at an introduction to predictive analytics through an illustration of a 6-step process. Part 2 of the HR Analytics series is called Breaking the HR Analytics Paradigm. We're going to be looking at hourly workforce data. First thing we're going to look at is recognizing the low-hanging fruit associated with the examination of hourly workforce data. We're going to focus on operational and cost savings opportunities associated with 3 distinct areas. First, absenteeism, including Family Medical Leave Act in the United States. Secondly, the hourly hiring process. And thirdly, hourly employee payroll data. And the final module in this series is Part 3 that deals with healthcare analytics. We're going to gain an appreciation for the importance of plan design decisions in driving overall employer healthcare costs. Look at things such as employee cost share, delivery models, and clinical programs. In addition, we're going to look at the identification of multiple levers, strategies, and tools available to mitigate rising healthcare costs, and also we'll have to do an in-depth understanding of a 3-step analytical approach to identify key focus areas in order to facilitate potential cost reduction strategies. And we'll also look at a comprehensive strategy to address high-cost elements utilizing the reduce model. And the idea here is to develop win-win solutions for both employers and employees and their unions. Thank you for your time. I hope that these webinars provide you with valuable guidance and practical solutions in addressing the many HR and labor challenges facing your organization.